was once we had a wedding in the hospice. There was a Chinese patient who wished to get married when she was nearly going to pass on.
The team here worked together to help the couple solemnize their marriage. The whole team helped to decorate the room with balloons and flowers, and we haven't had a cake. That moment taught me that it is important that we come together as a whole team and try our best to help the patient fulfill the last wishes.
I think our staff here are willing to go the extra mile even though it's not within the job scope. We work as very much like a family. We share the joys, we share the pain.
Working in a hospice is really challenging because we have to face we have to manage the patient's symptoms, and we also have to manage them psychologically, and we have to give them comfort care. To me, I feel that it's a really fulfilling job because not only we care for our patients over here, our patients also do care for us, and they also teach us a lot of life lessons that can help me to grow and learn through this journey.
I think Dover Park Hospice has shown in the past 20 over years to be very forward-looking in terms of training and educating not only people providing palliative care, but also for family members and volunteers as well.
I'm in befriending. The whole idea of that really is to get people to be interactive. They ask you, what are you doing today? You say, we're cooking today. They love it. We've done mee siam, like today we did laksa. We've made pineapple tarts for Chinese New Year. And I think that's what it's all about, really, right? Because what you've done is really giving them that gist for life. Whether it's a day, a second, a minute, an hour, whatever it is, they say, hey, we really enjoyed that.
When I was a schoolgirl, my grandfather was admitted to Dover Park Hospice. I had the opportunity to observe the nursing, medical and allied health team work together to provide professional care in handling his condition. Even though my family was sad, we were at peace as he was well taken care of. This inspired me to become a nurse.
The greatest lesson that I've learned while working in Dover Park is to live well when I can and die well when I have to. I also learned that death is not just a medical process, but also a psychosocial process. It involves not just the patients, but also the family members and their friends, their relatives, their neighbours, their community. When patients come face to face with death, it's a time when we can help them to examine and reshuffle their priorities, to base their lives and their behaviour on what really counts. We can work with patients and family members to a certain point, and then death happens for the patient, with the patient only. No family members, no healthcare professionals can walk that journey with them, but we prepare them beforehand.
I think as mortal beings, all of us have to go through this phase of life where we face death and dying, both individually as well as among our loved ones. It is an area of care which has been neglected for many years. It's important because how well you provide palliative or end-of-life care is reflective of the quality of healthcare of that particular country.
I see palliative care as a calling. It used to be the discard. So my patients, they used to just come to us. Nobody wanted to see them anymore. They had no more money for the oncologist. They had no more money. No other doctor wanted to see them. And there was no specialty last time actually to treat them. They were just forgotten and left to their own means. But now that palliative care has come about, we are trying to actually take care of the patient in that last segment. We don't want them to be forgotten or abandoned actually. We are one big family and we all work together for a common goal, which is to enrich our patients' lives. Actually, a hospice is all about life. When we take a step back, we just look, what is our goal of care? What does the patient want? We take their views, their personhood, their wishes for their own treatment into very, very high consideration. But I would say to come and experience it, and unless you have experienced it and seen the life in the hospice, you know, then you truly understand what palliative care is about.